Wonderful Parham Zar here as well. We're just going to let a few more people trickle in. Thank you so much for joining us today for a webinar on the surrogacy process. Unfortunately, Dr. Court has had a personal matter that he's got pulled into. So today's chat is just going to be with the amazing Parham Zar flying solo. So we thought we would make this more of an intimate Q&A where you can ask any questions you have. As some of you may already know, Parham is the founder of the Egg Donor and Surrogacy Institute. He's helped thousands of intended parents bring their dream of parenthood to fruition. He has over 20 years working in the field. So we'd love if you could pop any questions you have in the box. And I'm going to start with a few frequently asked questions that I know you get, Parham, and we can dive right into things. So Parham, let's kick it off with an overall question. Who may benefit from gestational surrogacy?
That's a very important question. First of all, let me say hello to everyone. I'm sorry that Dr. Court was not able to join us for personal reasons, but I hope that you'll find this webinar informative, and my goal is to answer all your questions. So please feel free to ask as many questions as you can, and I will answer them as they come in. I think, Nicole, you're able to see the questions coming in as well, right?
I should be able to once they go in the box, but yes, I'll be moderating. And
I see some questions coming up in the questions and answers section. So
okay, perfect.
Who would benefit from surrogacy? Of course, when you think about having a child, a pregnancy, people think about normal heterosexual couples that decide to have a child, they have sex, and a baby is born. Of course, to have a baby, you need four things. You need an egg, you need sperm, you need embryo, and you need a uterus to carry the pregnancy. When any of those four are not present or there's a challenge with them, we are blessed to be living in a day and age where we have options for them. So we could be using an egg donor, a sperm donor, of course, the embryos that are created from an egg donor or sperm donor, and someone who might be willing to carry the pregnancy for the couple. Usually, women who cannot carry pregnancy themselves, it's either because of uterine issues, they might have had bouts with personal health issues, or they might have been they might be at an age where they can no longer carry pregnancy themselves. You also, when you look at individuals or same-sex couples, who by definition are going to need the help of an egg donor and a surrogate in order to have a child. So those are generally the individuals and couples that benefit from surrogacy.
Okay, great. And what steps are involved in finding a surrogate carrier? We as an agency, we look at many different factors. The American Society of Reproductive Medicine has guidelines. Resolve has some guidelines. The physicians have guidelines. We also have our own internal guidelines. When you as an intended parent start going through this journey of finding a surrogate, there are certain things that you might be concerned about or thinking about. Who is the surrogate? Will she be taking care of her body? Is she going to be eating healthy? Is there any drugs, alcohol, how is the family dynamics? Will she have the support of the people around her? Everything that you would worry about, we really worry about 100 times more because we do about 100 cycles a year. So with the surrogates that we have, I want to make sure that you as an intended parent have no headaches, and of course, we don't have any headaches. The screening is a rather long process. At the minimum, we want to make sure that the surrogate is between the ages of 21 and 40. The height and weight have to be appropriate, so the BMI of the surrogate is extremely important. We want it to certainly be under 30. Some doctors might accept up to about 32 BMI, but we generally want them to be under 30. They must have had their own child. They must be raising their own child. That's for, of course, emotional, psychological, and also legal reasons. Within gestational surrogacy, we're not using the genetic material of the surrogate. So the surrogate doesn't have a genetic link to the baby. And that makes the factor of the emotional attachment to the baby a lot easier. I hope that answers the question.
I know we've got some similar ones rolling in the chat here, which I think you already went over this. Someone asked what types of criteria must they meet in order to become a surrogate or an egg donor. Is there a difference between what they need to meet to be an egg donor?
Yes, of course, it's a very different. So with an egg donor, we're actually using the genetic material of the egg donor. Egg donor cycles are mostly anonymous, by the way. So the intended parents and the egg donor do not know each other's identity. They get a lot of information about the egg donor, but the identity of the egg donor is not known. However, there is a lot of information about the medical history, the genetic makeup, the parents, grandparents, siblings, eye color, hair color, health, education, a lot of information. Of course, there is medical screening, psychological screening for the egg donor that is done as well, and genetic counseling to make sure that there is no recurring genetic issues within the egg donor's family. With a surrogate, we do medical screening, psychological screening, criminal background check, a home visit, and of course, the general checkup and fertility checkup are two separate items. One is to make sure that the surrogate is generally healthy. So we check their thyroid, we do their pap smear, all their blood work to make sure that they're in general good health. And the fertility specialist will do the fertility checkup. So they check the uterus, they do the hydrosonogram to make sure that the environment is suitable for carrying the pregnancy.
Okay, great. And on that note, we just had another question in the chat box. What type of professionals are involved in the IVG and embryo transfer process?
So when we are talking about the medical aspect of it, of course, it's the fertility specialist. And within the fertility specialist's world, there are three entities that are extremely important. It's the endocrinologist or the fertility specialist himself or herself, the embryologist, and the embryology lab within the fertility clinic is extremely important because ultimately they're the ones who are collecting the eggs, sperm, grading them, mixing them, creating the embryos, grading the embryos, finally handing the embryo to the fertility doctor who will be doing the insemination. And the third very important aspect is the nurses, the nursing staff and the coordination staff, because ultimately they're the ones who are communicating with you as the parent or with you as the surrogate. And of course, we at EDSI, we will be in communication with everyone. But the main core of the fertility specialist office is these three. There are many other professionals that we at EDSI become the glue between. So when we're dealing with the fertility specialist, with the intended parents, the egg donor, the surrogate, the lawyers, the psychologists, the insurances, the OBGYN that will be delivering the baby, the hospital where the surrogate will give birth. All of these aspects are what we coordinate. So we become the glue and make sure everybody is communicating and everybody's on the same page.
Okay, great. And can you speak a little bit more about the medical process involved?
Absolutely. So for you as an intended parent, there is certain medical aspects. So depending on whether it's the egg and sperm source of the intended parents, there is medical processes for that. If we're using an egg donor, obviously the egg donor will be taking the shots and preparing her body for the egg retrieval. The IVF process is pretty much retrieving the egg from a source, retrieving the sperm from a source, creating the embryos, and ultimately inseminating those embryos into the woman who will be carrying the pregnancy. That's the gist of the medical process. From start to finish, the IVF process just alone is about a 2 to 3 month process. Of course, when we add to that the amount of time that we need for matching, for screening, and also the duration of the pregnancy, we're looking at usually about a 15 to 18 month process.
Okay, great. And can you speak a little bit about the legal ramifications of third-party reproduction? I know we have a question in the chat box. It says, in what states is surrogacy legal? What do you recommend for parents that are confused about their state surrogacy laws, and are lawyers necessary?
Well, a lawyer is 100% necessary, and usually 2 lawyers are necessary, if not 3, and I'll explain. The laws of the state that should apply are where the surrogate lives, not where the intended parents live. So the prevailing laws that we want to look at is the residence of the surrogate. There are many states within the United States where surrogacy is legal. They have different aspects of the legality. Some have certain restrictions, requirements, whether you can get a pre-birth judgment, whether you need to get a post-birth judgment, whether you can go through some sort of a mini adoption. Those are the different nuances of the states. We at EDSI will be happy once we identify a surrogate for you. We will put you in touch with amazing lawyers within those states that can guide you through the entire process and make sure that your legal rights as intended parents and as surrogate are definitely protected.
Okay, great. And another question that I know you get all the time is, do children born via surrogacy know about their surrogate?
The children that are born through surrogacy, do they know about the surrogate? I certainly hope so. Of course, you know, I've been doing this for 20 years, a long time. And the norms have changed, attitudes have changed, knowledge has changed so much, and awareness has changed so much within the years. So when I first started my journey through this life of egg donor and egg donation and surrogacy, there was a lot more concern with privacy, and a lot of times not just privacy but shame around the fact that the parents were creating this amazing life. And there is a big difference between privacy and shame, by the way, and I hope that there should never be any shame behind creating a miracle. As attitudes have changed and more people are becoming aware of surrogacy and egg donation, there are more books, more resources available to parents to be able to talk to their children in the appropriate way and really age appropriate, to let them know their story. Ultimately, you know, of course, in this day and age of 23andMe and genetic, counts, genetic availabilities to individuals, you can't hide the genetic makeup of a child. So of course, if parents are using an egg donor, it is in their best interest and the child's best interest to share their story with them and let them know where they came from. And the child will own their own story, whatever it is. And I assure you, they will grow up much happier knowing their story than have something hidden from them. And maybe as a teenager, they find out that my mom is not my mom or my dad is not my dad. So these are all very important conversations to have with the children from the very early age. Surrogacy, the same. So, you know, there is age-appropriate conversations to be having with the child. We have amazing counselors and psychologists who you can talk to, and they will guide you through all the process, and also books that you can read to help you with that.
Okay, great. And how much contact would an intended parent have with their surrogate, and how involved would the intended parent be with during the pregnancy?
One thing that you have to understand as an intended parent is that this is supposed to be your pregnancy. So you have to be in control, and we want you to be in control of all the process. Ultimately, all the decisions that need to be made about the embryo, about the fetus, about the pregnancy, about the baby, before birth, after birth, these are your decisions. So there is a lot of contact. Whether we're looking at human factors and whether people become closer as their relationship evolves or continues is a different story. I've had many intended parents who sit in front of me and they say, you know, I don't want to have a close relationship. I just want to make sure that the surrogate is taking care of herself, and I don't need to be, talking to them every day. As long as they're doing their job and I know what's going on, that's great. Only to find out that 9 months later, they are best of friends and the surrogate has become like a part of the family. And that's the family dynamics that builds, or friendships that build throughout the journey. On the other hand, we've had also surrogates, intended parents, who really went into this journey wanting a close relationship. And at the end, that relationship doesn't evolve. So these are all fluid and they evolve the way they evolve. However, the issue of the matter of control and then the availability to the intended parents to be there for whatever appointments, ultrasounds, of course, the birth, for them to be involved as much as possible and for you to feel comfortable to know that this is your baby and you need to make those decisions and be there for those decisions is extremely important.
Okay, great. Molly popped a question in the chat box here on how much contact the surrogates and intended parents have during the pregnancy. And it sounds like from what you said, it's as much as they would like.
It is as much as the parties are comfortable. It's funny because I always get from the intended parents, am I bothering my surrogate too much? Am I calling her too much? Am I getting involved in her life too much? Am I controlling too much? On the other hand, I have a surrogate who says, why aren't they calling me? This is their baby. Don't they care about their baby? And don't they, I'm kind of oversimplifying it, but also ultimately everybody is kind of concerned about the other side and they want to make sure that the other party, whether the intended parents are looking at the surrogate, they don't want to be overstepping their bounds, and the surrogate actually wants more involvement. So it's always a fine dance, but find your comfort level. Make sure you advocate for yourself. If there is anything that you need clarification on, reach out to us, reach out to your surrogate, reach out to the doctor. You need to have your questions answered. And ultimately, it's your baby. If you need to find out more, don't hesitate to ask. It is your baby. And as a surrogate as well, advocate for yourself. Know your body, know the limits of your body. If there is anything that's being asked of you that doesn't feel comfortable to you, discuss it. Discuss it with us, discuss it with your intended parents, discuss it with the doctor. Ultimately, we want everyone to have the right journey, and that's the goal.
Absolutely. And what stands out about EDSI's approach to gestational surrogacy?
Really, the most important thing is the hand-holding that we do. And the key factor is I don't want any headaches for you as an intended parent. So we do a lot of homework beforehand. All of the surrogates that we present to our intended parents, they've already done all of their medical screening and medical checkup, not fertility checkup. Those are done by your fertility clinic, but we make sure they are physically healthy. We have all of their medical records, their psychological screening, their criminal background check, their home visit, so that we're not wasting anyone's time. There are certain agencies where anybody who walks in, they become a surrogate. They're welcome. Now you become a surrogate. And once they are going through the matching process is when they do the screening. And they are screened out then, which becomes a little bit frustrating for everyone. Within our program, no more than 2%, usually 1 in every 100 applicants that we receive actually become a surrogate in our program. But that is the assurance that I want to give to our intended parents, is that my guarantee to you is any surrogate that we provide you will be an amazing surrogate.
Okay, wonderful. And on the flip side of the coin, we've got a question here. What does the screening process look like for intended parents?
Depending on whether you are using your own genetic material, there is, of course, screening that involves, ultimately, if you're looking at, for example, a married heterosexual couple, and they're using their own egg and sperm, so the egg and the sperm, those need to be screened, and they do their FDA blood work and check for everything else. There is a medical procedure for the retrieval of the egg. The husband has a much easier job. They send him in a room and they say, come back with a specimen. Not hard, but for the intended mother, of course, it requires the shots, it requires the actual medical procedure in order to retrieve the eggs. Of course, if you are a same-sex couple, for example, then you will have an egg donor. So there is no medical procedure on that end that you're doing. We need the sperm source. So either of the couple might be the sperm donor. And for them, again, there is blood work, FDA required screening that's done. And then the IVF. So they will create the embryos with the sperm and the egg.
Amazing. Another few questions. Where is surrogacy legal?
It's legal in a lot of the states. For example, California, Arizona, Nevada, New Mexico, Pennsylvania, New Jersey, many states that we look at, Utah, Ohio, Washington. There might be different degrees of how the law applies on whether the intended parents' names will be placed on the birth certificate from the get-go, which is ultimately what we want. What we want to make sure is through the legal process is that from the moment the baby or the babies are born, the names of the intended parents are placed on the birth certificate and not the name of the surrogate. New York, for example, surrogacy just became legal as of February, gestational surrogacy, by the way, where we're not using the genetic material of the surrogate herself, just became legal in New York as of February 15. New York still has to work out some kinks around the laws, which I hope they will, and it'll be amazing for anybody who lives in, especially the surrogates that live in the state of New York. Again, intended parents can be anywhere in the world. What really matters is where the surrogate lives and to make sure that the laws of that state are surrogate friendly.
So do you think with New York changing the law that other states are going to follow suit?
Yes, of course. I think not only looking at the United States and the laws changing, I'm hoping that we will see all over the world countries where surrogacy is still legal, that they will look at it more closely and make sure that their intended parents can avail themselves of this amazing miracle option of creating a child. But even if they don't, know that within the United States, you have a lot of options. Come to the States and reach out to us at EDSI, and we will be happy to guide you through the entire process.
Okay, great. And one more from our Q&A. Would you say having open conversations like this makes surrogacy a more open and normal process?
100%. You know, in the 20 years that I've watched this evolve into the story of what surrogacy is now, I remember that first there was just, when I would say I run an egg donor and surrogacy agency, there would be puzzled looks or blank looks because nobody knew much about it. As conversations started happening, first it was through comedy, by the way. So if you remember shows like Friends, where Phoebe was a surrogate for her brother, or Baby Mama. So it's within the context of comedy that people start talking about surrogacy. And then it became more about the sensational aspect of it. So when they would look at the fear-based questions, oh, will the surrogate keep the baby? Or, you know, the myths around the someone carrying somebody else's child and what could happen as a result of those things. So those are the things that were being discussed. Or the story of military moms who were carrying pregnancies, and it became, you know, whether they should use their insurance or whether they were using the medical system and all of those sensational aspects of it. But then it evolves into the real conversations that one needs to have. And the ultimate, really the message that one should get out of it is the message of hope. And that's the most important thing, because it really gives an option to parents who otherwise could not have a child. And that is the ultimate goal and the ultimate blessing of surrogacy.
Absolutely. Molly asked in the chat box, can someone be a surrogate for a friend or a family member?
Yes, however, the surrogate, the individual who wants to become a surrogate should really go through the entire screening that one would do with any surrogate. So we have to make sure that, or you have to make sure that they go through the proper psychological screening, medical screening, the criminal background check, all of those aspects, the family dynamics, the support that the surrogate needs, those all need to be looked at even more carefully, because when you look at a known surrogate, those dynamics could also play a huge role in the relationship that people will have. So I think those are even more important in a known surrogacy case than they would be, which we do in gestational surrogacy anyway. But I think for known gestational surrogacy, it even becomes more important.
Okay, great. And I know you touched on this a little bit earlier, but I wanted to go back and revisit the myth of like, won't the surrogate want to keep the baby? Can she keep the baby? Will she become attached? Can you speak a little bit on that?
Yes, and I do. It's a very good question, and it's an important question, and I get a question that I get often. And there's always two answers that I have. One is actually jokingly, I tell the intended parents who are sitting in front of me, I say, can you imagine that there is a surrogate sitting in front of me who's asking me, how do I know that the parents are actually willing to come and take the baby, that they will not leave me? And as funny or as you know, as ridiculous that might sound, it is a fear that a surrogate could have. And so when you look at the myth of whether a surrogate would want to keep a baby, you know, first of all, I've been doing this for 20 years. I've never seen anything like it. And I think the evidence has shown that it does not happen, especially if we as the agency are really doing our job properly and we are screening our surrogates so meticulously. This is why they must have had their own child. This is why they are raising their own child. This is why there is no genetic link between the surrogate and the baby. And usually the surrogates have had their own family, and now they really know that they're helping someone else. What surrogates usually tell us is when they go through the pregnancy, it feels different than when they were pregnant for their own child. That it really, to them, it feels like babysitting. You know, that's a simplified way of looking at it. But when we are vetting our surrogates, these are important issues that we're looking at. And, you know, thank God that we haven't had any issues at all so far.
Yeah, well, I'm sure you just put a lot of people's fears to rest, because I know that is something that, like you said, we see all the time in different TV storylines. And someone else has asked another surrogate question. Recently, Khloe Kardashian mentioned that the surrogate can end a pregnancy. Can you give us examples of how a surrogate can do that?
When we sign contracts between the intended parents and the surrogate, we want to make sure that a couple of things are extremely important and understood by everyone. If there are any decisions that need to be made about the embryo, about the fetus, about the child, those should be you as the intended parent's decision. And those will be written into the contract that way. So God forbid if there are any issues that need to be covered as far as abortion, reduction, genetic abnormalities, or decisions that nobody takes lightly. But of course, with the guidance of a physician, those decisions that need to be made, those should be made by the intended parents. Of course, if there is any issue that is affecting the health of the surrogate, then those decisions have to be made by the surrogate and by her, you know, with her spouse or partner. And so those are the important delineating factors that we make as far as who makes the decisions. About the fetus, about the child, it should be the intended parent's decision. About the health of the surrogate, it should be the surrogate's decision.
Okay, great. Thank you for breaking that down for us. And one more question for you. Does my surrogate need to get vaccinated for COVID?
That is the million-dollar question. And that is actually one of the things that goes to classic type of matching that we do. Yesterday, I had two conversations with two different sets of intended parents. One set of intended parents, they insisted that whatever surrogate they're going to be matched with should be vaccinated because of the fears that they had of COVID. Not even a half hour later, I had a conversation with another set of intended parents who said under no circumstances would they want their surrogate to be vaccinated. because they thought it's too new and they didn't know what the effects of the COVID vaccine would be on the surrogate. By the same token, we have some surrogates that do want to get vaccinated and some don't. So it is really a part of the traditional type of matching that we do. We have to make sure that everybody's politically, religious-wise, in every way on the same page when we talk about issues of, one embryo transfer, two embryo transfer, genetics, abortion, reduction, all of these things, and now COVID vaccine. These are the factors that we take into account when we do our matching.
Absolutely. It's such a complex situation, and that's why it's important to have an agency that you really trust, that you can work with. I think that is all of the questions that we have in the chat box. Parham, is there anything additional that you think people should know?
Yes, something very important is I want to make sure that you build the right team around yourself. I think this is the most important thing. When you embark on this journey, I always look at it as a battle. You're going into battle. Make sure you build the right team around yourself. You have the best doctor, the best agency, the best surrogate, the best egg donor, the best lawyers, the best of everything, so that you go into the battle with all the bets hedged in your favor rather than the other way around. So advocate for yourself, ask a lot of questions, reach out to me. I'll be more than happy to be a resource for you, to answer any questions you have or to guide you in the right direction. I know this world can be extremely overwhelming. You should not be left on your own. I spoke to a set of intended parents yesterday who were telling me that they had spoken to another agency and the agency told them, well, we'll find you the surrogate, but then you have to find your own lawyer and you have to get the insurance. And once your surrogate goes into the screening, you have to help your surrogate, book her flight or whatever else it is. Make sure you're working with an agency that has the bandwidth, that is giving you the support, that's covering all of these things for you. You are going through all of these for the first time, and it's not fair that you should be left with figuring out how to do these things. This is what we do as an agency. We want to make sure that it remains a seamless process for you and for your surrogate, and that's why we give so much support to both you and your surrogate.
That was a great overview of the surrogacy process. Like Parham said, if you want to get in touch, if you have any other questions, his email and phone number is on the screen in front of you. And we will be rescheduling the webinar with Dr. Kot, so you can expect an email with a new date and more information on that as well. Thank you guys so much for joining us, and thank you for your time, Parham.
Thank you. I really enjoyed this, and I'll be happy to answer any questions anyone has. Just reach out to me.
Bye, guys. Take care.
Thank you.